So we started about 10 years ago working on the virtual twin of the heart, and we put together a large consortium of 200 members that included academia at Stanford and Harvard, MIT, industry organizations such as Abbott, Edwards, Medtronic, leading cardiologists at Boston Children's, at Harvard Medical, UPenn, as well as the FDA and other agencies. And from that, what we've done is built a 3D model of the heart. That 3D model has all of the structural anatomy features, all the way down to individual muscle fibers that make up the heart, the complex valves that open and close to pump blood through the heart, and the structures that support them. It includes the ability to deal with understand the blood flow or the hemodynamics as blood moves through and out of the heart. And it includes the electrophysiology, so how irregular heartbeats happen and how you can potentially treat them by dealing with some of the nerve fibers that are in the heart. From that, we've served two different constituents. One of the constituents are those that are designing new treatments for heart disease. So companies like Abbott, companies like Pfizer, companies like Bayer, who are trying to understand how patients' individual diseases and population of diseases occur in patient populations, and how to design devices that support a wide variety of different patient populations. So they're not just designing things and testing them in the 40-year-old male heart, but they're also making sure that they're simulating how well does this work in a female heart. Equally, what we've done is work with clinicians to understand how they can create personal treatments for individuals. We have a number of different cases in that space. One is, for example, patients that need to have a valve replacement. Again, my heart's different from your heart. I have a different size valve that I need, and so we can use a virtual twin of your heart to determine what's the right size, and then more importantly, what's the right placement. Because when you're putting in a heart valve replacement, millimeters matter. And so making sure that you can understand and simulate what's the outcome going to be in terms of blood flow returning to normal course of action is something that we can do in our software. Finally, what we've been doing with clinicians that is really inspiring is work with children who have congenital heart disease. And Dr. David Hoganson from Boston Children's has used the Living Heart Project to scan an individual child who's been born with a congenital heart defect, meaning their heart didn't grow like anybody else's in the world. And what he's able to do is to construct a 3D model of their heart and then perform in the software virtual surgery and determine, is this virtual surgery going to work and deliver the outcome that you would hope, or should I take a different approach? From that, what he's able to then do is, in many cases, he has to put a complex patch into the patient's heart to reconstruct some of their anatomy. The software is able to allow him to construct that complex three-dimensional shape that he then has to cut out of a 2D piece of tissue and project that 2D shape onto the tissue so he can cut it out to sew into that individual child's anatomy. This allows him to then ensure that not only is it going to fit, but it's something that's going to allow it to grow with the child as the child obviously grows. The final thing that he's able to do with the Living Heart model is patients, the parents of the child, they don't understand cardiovascular or cardiologist gobbledygook, but with a picture being worth 1,000 words, a 3D model and a visualization with the VR headset is worth even more. And those parents can now understand what is the procedure that's going to be performed on their child and how it's going to help them restore normal function and have a long, healthy life.